Good evening, everyone. Welcome to Late Night with Lex. Tonight we're going to be talking about the Transgender Wellness and Equity Reentry Fund, AB 1487, established in California in 2020. The State Department of Public Health Office administered the TGI Wellness Fund to create programs, support existing programs that seek to focus on trans inclusive healthcare for those who identify as transgender, gender nonconforming, or intersex, and seeks to assist individuals who have experienced the carceral systems. $13 million was appropriated by Governor Newsom in 2020 and was announced and passed as AB 2218 under the Trans Health Equity Fund at first. Basically, what this policy seeks to do is to increase the healthcare capacity to provide trans inclusive care through training and educational opportunities. Not only that, it's available to TGI organizations that facilitate things or programs that center arts like writing, dancing, or painting. In the policy, they make it clear that TGI orgs mean that over 65% of participants identify as trans, gender nonconforming, or intersex. Expanding access to trans housing under this policy includes case management, assistance with getting trans individuals housing vouchers, and funding existing housing programs that may provide subsidies, may have permanent supportive housing, and different services around this area. It's also available to hospitals, healthcare clinics, or medical providers that are able to provide hormone therapy and even gender reassignment surgery. The caveat is, though, that if places like hospitals and clinics want to be a part of this fund, they have to and are required to partner with the TGI organization in order to make sure that they're providing the most trans inclusive. At least 218,400 people in California identify as trans. High rates of mistreatment in culturally incompetent reentry settings lead to increased reincarceration of trans people. 12% of the population under the jurisdiction of the Department of Corrections and Rehab are incarcerated due to parole violation. According to the Department of Corrections, as of March 26, 2023, there are 1,706 incarcerated people who self-identify as TGI. That doesn't include, and I mean, these are self-identified folks, so that doesn't even include the people who, haven't even, that aren't comfortable with saying that they're trans. And, after they leave prison, housing is a huge barrier for folks. A lot of reentry programs do not have programming specific for TGI individuals. Not to mention that many of these places have implicit bias, lack cultural humility, and unfortunately, many trans individuals experience family rejection. So the lack of housing is really, really neat. And unfortunately, there are many providers that do discriminate against trans folks and are not willing to provide hormone therapies or gender reassignment surgeries. And this really affects not only their physical bodies, but also their mental health and how they move through the world, not being able to fully reflect and some of the key stakeholders include TGI individuals, nonprofit organizations, the social workers, case managers, other service providers in these settings, city council, politicians, doctors, nurses, hospitals, clinics, and even property managers. When looking at the policy, this is going to be measured through data. And maybe that may not be included in the policy, but when it comes to sustainability and long term solutions, I'm curious if this is a one time thing, if this is just trans equity and reentry fund is just one and done, or is it going to keep going on and thinking about how, medical, thinking about healthcare and housing and how those things do not just, they need their ongoing services that need to be provided. So how will this money be effective comes to the impacts of this policy with the recent, well, I don't want to say recent, but with the amplified transphobia and homophobia within politics, many organizations are concerned about actually being able to get the funds to provide trans inclusive care. Due to Trump's recent executive order, St. John's had a pause. St. John's in California had a pause and lost $1.6 million. They were specifically going to receive these grant funds to push their HIV prevention program forward. And the recent executive orders have been causing a lot of concern and worry among many organizations. And while there are rising concerns about federal funding getting taken away, there's still state laws that require medical insurers to cover the costs of gender affirming care. At least in California, there is. A lot of trans individuals would greatly benefit from this policy. Organizations such as the Trans Latina Coalition, TGIJP, Lavender Phoenix, they all provide vital healthcare services to the TGI community. Not only that, I used to work at TGIJP and they provided services like subsidies, case management, HIV prevention. A lot of times they're also empowering folks to contribute to their own communities and hiring their own community members that are involved in receiving services. Housing folks provides opportunity for them to focus on their health, whether that's substance use, relationships, and just focusing on thriving every day. The impact of not getting their basic needs met is literally death. I have unfortunately had clients die while waiting to be housed. Nothing can be viewed as too small or not a priority when it relates to trans health. Some recommendations I had were possibly including and reviewing requirements for funding. What requirements do organizations need to have besides being trans trans-centered organization? Are there priorities in how money is getting distributed? Not just that, it would also be really great to know how they're going to address concerns for long-term solutions. Providing trans healthcare and trans inclusive services is not just a one-time thing. It needs to be something that's sustainable. It needs to be something that can actually, it needs to be something that can last. And I would love to know how politicians and legislators are looking to provide those in these trans communities. Thank you for coming to Late Night with Lex and chatting more about AB 1487. Have a good night.